Welcome back for another episode of Psyched Perspectives. I'm your host, Dr. Frank Clark, and today I am joined by Miss Chelby Drafts. She is currently Miss Golden Corner 2026. Shelby is someone who embodies advocacy. She is someone who also really enjoys empowering women. She is one of four siblings. She has sisters. She grew up on a farm in a rural area of Gilbert, South Carolina. And today we're going to be talking with her about the importance of destigmatizing substance abuse. We're going to be talking about her journey and her advocacy at a grassroots and state level, where she has been instrumental in advocating and collaborating with legislators in South Carolina to make sure that Narcan is available for colleges and universities within the state. She is someone that I had a chance to meet recently at a Dancing with the Palmetto Stars event as part of the Miss South Carolina organization, and I really enjoyed getting to know her after the event and over the last couple of weeks. So without further ado, welcome Miss Chelby Drafts. Hey Shelby.
Hi there. And I wanted to add, Mr. Frank Clark is a spectacular dancer.
I appreciate that. I appreciate that. Yeah, it's cool to get to see you again, and thank you for joining this episode. So, I am curious if you could tell me a little bit about what brings you joy and purpose. This is a question that I like to ask all of my guests when we do an episode.
Yeah. So for me, what brings me joy and purpose is knowing that my presence or maybe some of my knowledge has made an impact on somebody else. So I know you'd mentioned the Palmetto State Stars program, Dancing with the Palmetto Stars. So there's actually a program for young ladies where Miss contestants that are competing for Miss South Carolina can mentor these young ladies. But throughout my journey of advocacy and learning about substance misuse awareness and education, I've learned that connection brings me the most joy.
That's awesome. And I learned that you were. I was reading your bio last night, and I know we talked a little bit. So tell me a little bit what it was like growing up in rural South Carolina, especially on a farm, and what have you learned about yourself based on your experience? Because I would guess that there are some invaluable lessons that you've learned living in a rural area and about discipline and work ethic. So I'd be curious to hear about those.
There definitely are some amazing life lessons that you can learn growing up on a farm. So it's not like it is in Charlotte's Web or the movies. Of course, like pigs are cute and all, but I grew up on a chicken farm. So we own over 12,000 chickens and chicken houses. And I started working there with my grandparents whenever I was a little girl. So that would come by cleaning something called feeder pans where the chicken feed would come in through giant vats and feed all of the chickens and things like that, especially on hot days like right now in July, really taught me to keep pushing myself further because although in the moment something wasn't the most fun and I was tired, I knew how important it was for my family and our source of income. And so that's really helped me into my adult life now and things that I aspire to do. I understand that sometimes things are not the most fun, but they're necessary in order to get something done, something meaningful, and something that will leave an impact on your life and your future.
That's great. And you were breaking a lot of cycles. You were breaking a lot of glass ceilings. If I remember correctly, you will be the first in your family to go to college and graduate from college. Is that correct?
Yes, that's correct on my biological mother's side of my family. Yes, so I will be the first, and I actually won now almost $10,000 in scholarships to continue my college education.
Congratulations and kudos
Thank
to
you.
you. So, You've talked to me, I know after the performance or after the event at Dancing with the Palmetto Stars, I know we had a moment to briefly connect, and you talked to me about your advocacy efforts as it relates to wanting to raise awareness more, not only in the state of South Carolina, but across the country about how we think about individuals who are suffering from substance use disorders. And I know you've talked about that this is personal for you in a lot of ways. So I would be happy to know if you could share with our audience why the advocacy regarding individuals with substance use disorders. Why is this so important to Shelby?
I'd be happy to. So, my biological mother has always struggled with a substance misuse disorder. She still does currently. And this used to be something that I was terrified to speak about or share, as a teenager, as an early adult, because I thought that I was the only one. Unfortunately, I have found that my story is not unique at all. Actually, there are millions of children with at least one parent in the household that suffers from some sort of addiction. So growing up and understanding how that can affect not only children but families as a whole has really moved the needle for me, because I understood that I didn't want to continue that cycle of substance misuse in my family. Whenever it comes to my children or my four little sisters, I want to make sure that that's not something that continues. So I think whenever it comes to substance misuse, it could be genetics, environmental factors, mental health takes a big toll on that as well. But it's important, and I understand it's an uncomfortable conversation, but it's real. And that's why I wanted to work alongside legislation to at least back it on college students. We understand that young people in college are really figuring out who they are and what they want to be. And that leaves a lot of room for making mistakes. And I wanted to make sure that if they were to experiment something, them being harmed was not one of those mistakes. So that's why I brought my idea to Senator Tedder, and we collaborated on that. So he was able to write a bill that got passed and will go into effect next year. So I'm happy about that. But that allows Narcan, a life-saving medication, across all public college campuses in the state. But not only that drug, but these young people and faculty are being educated on how to use it and the signs to look for an overdose.
Congratulations. That's a huge milestone, and I know the state of South Carolina is going to benefit from that. As you mentioned, college students are discovering themselves and they are evolving as we speak, and that's a good thing. And so we want them to be. I look at it to an akin of when in schools when we were had to talk about safe sex practices. I think it's similar in a lot of ways, and so we talk about prevention and making sure people have the access to the resources that they need in order to, make the best decisions for their life. And Narcan is a life-saving medication. I have had some patients who I've taken care of in the emergency department who have overdosed on opiates and have, if it wasn't for Narcan, they probably wouldn't be here. So I appreciate the advocacy and the this you being so proactive in this fight, because addiction does not discriminate, and it is something that it's chronic, and there's people go into remission, but people can also return to use, and for all the reasons that you mentioned, there can be just different stressors. And I was curious, have you found that especially I know I've worked in rural areas, I've worked in urban areas, and obviously, both of those areas have individuals or comprised of individuals that have substance use disorders. What do you think could be done to help destigmatize addiction or those individuals with substance use disorders, especially in rural communities?
I think it's just being empathetic and a little understanding. I want to go ahead and put out there that no one asks to become addicted to something. This is not something that someone is seeking outside of their external life. It's It's not fun, right? But it's real. And I think, especially in rural communities, there's a lack of a lot of resources, whether there's things like Narcan or education, proactive measures, the kind of education that maybe students, young people, children may need, so that substance misuse is never even an option. So I know we'd spoken before about how, at least in the state of South Carolina, those who suffer from an opiate addiction the most are women over the age of 60. Now, I've dived a little deeper into this, and I'm not 100% sure. So don't quote me to the listeners out there, but I have a feeling it has to do with lack of access to healthcare in more rural areas and probably education as well. Let's say a woman gets an injury and she's not provided maybe the right education or resources whenever it comes to that pain medication, and they can become very habit forming very quickly.
No, absolutely. It is, and sometimes pain is undertreated, which we know as well. And so you're right. Nobody just wakes up one day and says, "I want to try
Yeah,
Percocet."
right.
The things. A lot of times, I've had patients that they developed a substance use disorder following a dental procedure, or another major surgery. Sometimes it doesn't even have to be major. So I think it is important to realize that we are human beings, and we all have that dopamine in our brain that is our and that pleasure center, and we all crave different things. And so, I know you and I are going to be. We won't spoil that. We won't talk about the topic, but I know you and I are going to be co-authoring a children's book together, which I look forward to. So,
Me too. I'm excited about that.
absolutely. So I'm curious, what would you tell young ladies out there who, may be watching, that may be tuning in to this when it's completed and edited and shared amongst the masses? What would you tell little girls, young women out there who see you, someone who comes from a rural area, someone who has multiple adverse childhood experiences, and that is breaking the cycle, that is advocating on behalf of all women, all human beings, communities near and far, rural, urban, who has been at the South Carolina State House standing shoulder to shoulder with legislators? What would you tell those young girls, those young women?
Yeah, I the first thing is you hold the pen to your own story. Whenever you're young, you often don't have control on the environment that you are raised up, or the adults that may be in your life, or things that you may not be the biggest fan of. So it's really important to understand that you decide what happens next in your future. And that could be anything. To dream so big that it almost seems impossible, because I think that's really the difference maker between people who do everything they aspire to do and those who kind of hold back and do the safe option, is that they're almost too afraid to dream big. And as cheesy as that sounds, it's so important, because I never thought I would get a college education. I never thought that I could be someone who could speak about my personal life experiences and do something about it and help others who may be experiencing something similar. So I think take that leap of faith, trust yourself, and understand that you control the narrative of whatever you want your future to be. No one can do that for you.
Those are words of wisdom and
Oh, thank
very
you.
insightful. Yes, yes, we control the pen. As a poet, I know that very well. So,
Yeah.
um, so there's a couple more questions for you. So, you're talking about dreaming big. I've gotten to know you well enough to know that this is not the final chapter that you are writing in your advocacy journey. So, what is next for Miss Drafts?
Yeah, so I'm planning on getting this statewide bill on a national scale. I think it's super important, and I know I'm hoping to have the opportunity to speak with some amazing people and seeing if we can get something like that on the Hill. But not just that, I also want to see what ways you can get resources in more rural areas in the state of South Carolina. So I've been speaking back and forth with Senator Tedder. I will be working at the State House in August as a page. So this is for my own research purposes and building relationships and connections in order to get these kinds of things done and see what next steps I want to take. But as of right now, I am finishing up my school presentation program. I actually created one called You Hold the Pen, ironically, and I'm sending out emails to a bunch of schools to give this presentation because although intervention is super important, I like prevention as well because it's super important to teach emotional regulation and coping skills so that young people can deal with these hardships in their life so that substance abuse is never an option in their future.
Well, that's great.
Yeah.
I have no doubt that you will accomplish all the dreams that you have spoken and written and prayed about. So, and speaking on the topic of prayer, I know that your faith is important to you as a Christian, and the reason I wanted to bring that up, I'm curious, how do you think faith communities, not just Christian communities, whether it be Muslim, Jewish communities, what have you, um, how do you feel like faith communities can better support individuals with substance use disorders? And because I find sometimes there's this false dichotomy that is created, that if you have faith, then you won't develop a substance use disorder, or you won't develop depression or bipolar disorder or schizophrenia, and that could be further from the truth. So I would be curious, what are your thoughts on this topic, and what have you seen be beneficial, and maybe what you have seen be detrimental when it comes to faith communities and working with individuals with substance use disorders?
So, spirituality is super important, especially those who may be struggling with mental health or substance misuse. But I think at the end of the day, we have to understand we are human beings with human bodies, and having a tight knit connection with a group is super, super important. That support system means everything. But at the end of the day, we have to give people physical resources just as much as spiritual resources. So, whether that be something like a pamphlet to an organization called the Courage Center, which I have learned about this year. They provide free resources for rehabilitation or career opportunities and things of that nature. But that's something that I actually want to do this year is go into churches and kind of educate them on what substance abuse actually looks like and what they can do to help that. Because that support system is super important, but I also think we need to be empathetic and understanding and help point someone in the right direction. That way they're saved from this kind of disease.
Absolutely. All right, two more questions for you.
Okay.
The first question: what do you want your legacy to be?
I want my legacy to be one where other young girls or young women can look at me and think that they are capable of anything they could ever set their mind to. I want it to be known that you don't have to come from a well-off upbringing in order to be successful. You don't have to have this picture perfect life like an Instagram highlight reel in order to go after your dreams and pursue them and work hard. So I think it's just I want people to see me as a real person and think that they can do whatever it is they want to do just like I can.
Well, you are fulfilling that legacy, and I look forward to following your journey as you go forth. So I am very proud of the efforts that you're doing, not only at the state level, but soon to be the national level. And I know your sisters are proud of you as well.
Thank you. Thank you. I love them so much.
Yeah, absolutely. Okay, so this. Since you said you grew up on a chicken farm, I would love for you to share with our listeners and for my own educational purposes. What is one thing that maybe people wouldn't know about what it's like to grow up on a chicken farm? I'd just be curious.
The smell.
Okay.
So where we live, you can smell chicken houses before you see them. And I remember when I was a little girl, my friends would come over and spend the night at my house. And I was never ashamed of living on a chicken farm. I loved it. But they would come to my house and be like, oh my gosh, what is that terrible smell? And I'd look at them and I'd say, that is the smell of money. So, because that's the way we get our income. And so chicken farms don't smell the best, but you know, they're They're also not like they are on commercials. I remember being a little girl and they would show like chicken farms on agriculture channels, and like they don't look like that. These chickens are just chilling in their house. They've got plenty of space and they kind of just do whatever they want.
I like it. All right. Well, I'm gonna have to make it down to the farm in Gilbert because I
Yes, you
haven't
will.
have not been to Gilbert. So, well, very cool. I really appreciate you spending this time with me and us. And you've heard it here from Miss Shelby Drafts that you write your own story. You hold the pen. So as we go forth, I pray that everyone has a wonderful rest of their week. Whatever journey that you're on, remember that life is not linear. There are a lot of peaks and valleys, but the journey is what makes us whole and gives us perspective. So until next time, I'm Dr. Frank Clark. This has been another episode of Psyched Perspectives. Peace and blessings to you all.